Gauteng is facing COVID-19 third wave, and there is a rush now to get as many people vaccinated as possible. South Africa is already in phase 2 of its vaccine rollout campaign. In fact, since last week, so far over 1 million vaccinations have been administered. How prepared is the province of Gauteng for this third wave? I'm now joined by Dr Harsha Somaroo, a public health medicine specialist. Dr Somaroo, good afternoon, and thank you very much for your time. Do you think Gauteng is ready to deal with the third wave?
Hi, Dan. I'm sorry, I can't hear very clearly.
Can you hear me now?
Yes, that's much better. Thank you.
Okay, how ready, do you think Gauteng is ready to deal with the third wave?
Yes, no, I think the province has been preparing for the increasing cases that we've seen for quite some time now. I think over 4 weeks ago, we noticed the increasing trajectory in the number of new cases we were seeing every week, and all the various departments within the health team especially, but also external to the Department of Health, have been planning to manage these increasing cases. So, yeah, I think the planning is ongoing, but I think the province is confident that we will manage the increased number of cases that we're seeing.
Okay, let's look at different things one by one. Do we have enough hospital beds?
At the moment, yes. I think the hospital bed capacity is enough. I think the planning is going on with cognizance of what the demand was in the previous waves, and also projecting different increases based on the current trends that we're seeing. At the moment, I think there are enough beds currently, and also for the projected increases. And if the need arises, there are also contingency plans in place to add more beds for COVID patients should the need arise.
ICU capacity?
I think that as well, based on what we've seen in the past, I think the province is planning for that, and should be able to cope with the demand.
Okay, from what you know, what about oxygen?
Well, from what I'm aware, the province has been planning to have enough oxygen supplies for quite a few weeks as well. I don't know the details, but I think there as well, based on the projected needs, the province is prepared for the potential increase in demand for oxygen as the number of cases increase and we see more severe cases being admitted to hospital.
Human resources wise, I mean, we know that those in the front line have been vaccinated under phase 1, under the Sisonke trial with J&J, Johnson & Johnson. Now is continuing phase 1B. Some of those were left behind, and the net was expanded to including those workers in administration, for example, in clinics and hospitals around. But that's still going on. Human resources wise, I mean, do you think the capacity is there for enough nurses and staff to assist in case the numbers spike?
Yes, I mean, at the moment, there's no reason to think that we don't. I do know that there was, from last year to now, there has been a massive increase in the number of healthcare workers that have been employed. Unfortunately, I don't have the details at hand, but yeah, the thing is, planning for the potential third wave and for the demands on the hospital services has been an ongoing process in terms of hospital beds and all the resources that are associated with beds as well, and that includes specialized staff. So yeah, at this point in time, I think there's no reason to believe that the province won't be prepared, but yeah, unfortunately, I won't have more detail on that.
Yeah, no, I understand. We just wanted to get a sense from you as you're a public health medicine specialist. Finally, I didn't plan to ask you this, but the question came up now. On a scale of 1 to 10, how ready is Gauteng health system for the third wave in case we get a big surge?
I don't know if I'm qualified to rate Gauteng in that way, but in terms of the preparation that's been ongoing over many weeks, I'd give them a 9.
Okay, well, that's very high. Thank you very much, Dr. Somaroo. Sorry for putting you on the spot like that there. I didn't plan to ask you that question, but it came to mind there because we want to know, in case the proverbial hits the fan,